make sure to answer those at the end, okay? And if you have an absolutely urgent question, you can also use the raise hand feature. Okay, so I also want to say a big thank you to our sponsors tonight, Fulton Bank. They are sponsoring our entire ALICE initiative, our ALICE report, and our ALICE town hall this evening. So big thank you to Fulton Bank. We really appreciate their support of not only this program tonight, but all of our ALICE work. So thank you to them. Okay, I wanted to start out with a video for everybody because I really think the best way to introduce this topic is through this video that's provided by United Way Worldwide. But just to preface it, ALICE is an acronym for those of you who aren't aware. It stands for Asset Limited Income Constrained Employed. And so this is a way to define those folks who are, struggling to make ends meet in their households, but don't technically qualify as below the federal poverty line, but they're still not making enough to really make ends meet in their households. So I'm gonna pull up this video for us and hopefully we'll be able to hear it and watch it together.
It's the senior couple who lives across the street, the child care worker who looks after your children while you're at work, the bank teller you chat with during your lunch break, the teacher who got your child interested in reading, and the 24-year-old nursing assistant who is helping to save lives every day. ALICE stands for Asset Limited, Income Constrained Employed, and is an acronym for the 1.3 million Pennsylvania households who earn an income higher than the federal poverty level, but less than what they need to afford basic living expenses. 12% of Pennsylvania households live below the federal poverty level, and another 27% are ALICE households. That's roughly 1 in every 4. These two groups amount to 39% of Pennsylvania's population, and every day they struggle to make ends meet. ALICE are proud, hard-working Pennsylvanians who pay taxes and are vital to our economy. They typically hold jobs that build and repair our infrastructure and educate and care for the general workforce. Many ALICE workers even have multiple jobs. But despite their hard work, ALICE struggles to pay their bills each month. ALICE has little or nothing in savings, and they are forced to make tough choices, like paying for quality childcare or paying their rent. A single working adult in Pennsylvania needs to make about $11.77 an hour, or roughly $23,544 a year, to afford all household essentials. A family of 4, which includes 1 infant and 1 preschooler, needs to be making a combined income of about $34.82 an hour, or $69,648 a year, in order to afford all household essentials. 32% of Pennsylvania families with children fall below this threshold. 58% of jobs in Pennsylvania pay less than $20 an hour, with almost half paying between $10 and $15 per hour. All the while, basic living expenses continue to rise. Over the past 10 years, Pennsylvania's bare minimum household survival budget has increased by 39% for a single adult and 46% for a family of 4. Because of these factors, the life that ALICE leads is volatile. ALICE's income tends to ebb and flow throughout the year, with some months being more financially stable than others. At any given time, ALICE households are only one emergency away from falling into poverty and needing some form of public assistance. This means that a car repair, a layoff, an unexpected medical bill, or having to miss a few days of work to take care of a sick family member could completely derail ALICE's financial stability. Can you imagine the stress of living on the cusp of such financial insecurity? There are many who carry that stress every day. ALICE lives across Pennsylvania, in every county and every town, and can be found in every age group. If you are not ALICE, you probably know people who are. ALICE is essential to Pennsylvania's economy because they are the people that make it possible for so many Pennsylvanians to do what they do on a regular basis. That's why United Way of Pennsylvania has launched the ALICE Project, an initiative aiming to shed light on a portion of the population that too often goes unnoticed, in hopes of changing the national dialogue about the impact on families and communities when financial crisis is the norm for so many. Traditional measures of poverty do not capture the magnitude of people who are struggling financially. This is why United Way of Pennsylvania published the Alice Report, which provides important data for understanding who Alice is, where Alice lives, and the struggles Alice faces. The Alice Report provides hard data to shed light on what it takes to provide for a household in Pennsylvania. Using the data presented in the Alice Report, United Ways are better positioned to advocate for the health and vitality of Pennsylvania communities and work with partners to maximize donor dollars and volunteer efforts for the greatest impact. We must come together as partners to assist Alice on a journey to financial stability. Pennsylvania's local United Ways are poised to lead this work, and we invite all businesses, government, and community-based partners to join us. Through continued community investments, collaborations, and advocacy, United Ways remain committed to uplifting Alice and working towards solutions for all Pennsylvanians to have opportunities to advance their financial stability. Now that we are aware of the struggles Alice faces, we must take steps toward building a more secure and stable future. Will you join us?
Okay, so that basically sums up the Alice population for us. I'll pull my slides back up just a second. So before we move on, I wanted to do a quick poll. The video mentions that many people in Pennsylvania know someone who's Alice or have been Alice at one point in their life. So Flame, it looks like I can't pull mine up when I'm sharing the screen. So could you pull up that poll for us? There we go. So we'll give a minute and folks can answer this question. Have you ever been Alice, asset limited, income constrained, employed? We'll just give it another minute here, couple more seconds. It looks like we're almost all in.
It's close.
Okay. So this is what folks answered in this group here. So we have a lot of people who have never been Alice, but have known someone or is close to someone who's in that Alice population. We have 34% of folks who at some point in their life have been a part of this population in the last 20 years, a couple folks who are currently Alice. So this is a real problem in our community, and it's something that is really prevalent. So thank you all for participating in that poll for us. Try to get to my next slide. Okay, so I wanted to share a little bit more about the Alice research and what exactly it's tracking and what this data means in the context of our communities. So the United Way of Pennsylvania and other United Ways throughout the United States are using this Alice framework to conduct research on financial hardship and track that financial hardship over time across demographic groups. They're quantifying the basic cost of living in Pennsylvania, figuring out how much people are typically paying for housing, childcare, all of those basic needs that people are paying for every day here, and really making that place-based based on what community, what county you live in. So that's what's really nice about this Alice research, is that it's very specific to our community. And the data that I'll show later is Lebanon specific. So that's what's nice about it. It contextualizes it. There's also a lot of assessing the job trends in communities and across the state. And it also identifies the gaps in assistance that we see in community resources for folks. So that's an overview. And the purpose of this data is to provide a practical and place-specific definition for financial hardship. I know in the video, and we'll get into this a little bit more in the next couple of slides, they mentioned how the federal poverty line is not really an accurate measure of folks who are having financial hardship. That those measurements haven't been really updated to match what's happening in our economy in quite some time. So they're not really a good measurement of how much you actually need to survive and have a running household in our economy. So the other thing is to demonstrate the real cost of living for families in Pennsylvania. That goes hand in hand, to expose some economic trends which hold back our ALICE families, and to debunk some assumptions and stereotypes about low-income workers. So we'll get into a little bit of that throughout the presentation. And finally, to help community members, policymakers, and local practitioners to address these issues in their communities. I also want to introduce this topic of household budgets. ALICE provides 3 separate household budgets for folks. And the first one I'll talk about is the ALICE Household Survival Budget. This is the bare bones, absolute bare minimum household essential budget. And that includes costs for housing, childcare, food, transportation, healthcare, a smartphone plan, taxes, and this 10% miscellaneous fund. We also have the household stability budget. This is the other end of ALICE when folks are just starting to get to the point where they're feeling more comfortable. They have a little bit of money that they can include in their savings. About a 10% savings category is included, and a little bit more in each of those budget categories that I discussed earlier. And the other thing we're going to discuss tonight is the senior survival budget. So we know that the cost of living for seniors is different than it is for most adults, because they have lower food costs, lower transportation because of fewer commitments with work and family, perhaps they're traveling less, and on average increased healthcare and out-of-pocket healthcare costs. And like I said, the federal poverty line from 2018, which is when this ALICE data was collected. All of the trends that we're going to be talking about tonight are 2018 data. But so for a single adult, that federal poverty line for the 2018 measure was $12,140. I think we can all agree that that would be very difficult to live off of as an annual income, and $25,100 for a family of 4. So what that misses is this whole population of folks who is unable to pay all their bills on their current income. And that's what the ALICE data is intended to kind of bridge the gap, to help us understand how many people in Pennsylvania really are struggling. And you see this graph on the right showing 27% of the 2018 Pennsylvania population falling into that ALICE demographic, and 12% in poverty. So that's only 61% of Pennsylvanians who are feeling like they can meet all their bills without struggling. So that's a huge number. And our population here is 12 million about, and number of counties is 67, and our households is just over 5 million. So just some data. I also want to share something about the benefits cliff. Some practitioners in this call may have heard of this before, but basically this is referring to the point of hourly wage where an increase in hourly wage actually makes a decrease in net income if you're somebody who is qualifying for public benefits like SNAP, childcare subsidies, and Medicare. So you see at this $15 wage that folks are making this amount of money, but if they make a little bit more, then they no longer qualify for those public benefits. And it's really like they're getting a decrease in pay to about $11. So that's a big problem for folks who are trying to climb out of tough situations and really advance, because if you advance past a certain point, there's this area called the benefits cliff where you're not able to cover your expenses and you may actually be making less in real income because of those lost benefits. The other thing I want to touch on is what we call the resource gap. And this is describing communities where there's a high population of ALICE folks who don't have access maybe to certain resources. So this can look like not being able to have transportation access, if there's no childcare facilities, publicly funded preschools, just gaps in resources that folks are unable to get because of the communities that they live in. So that's something to consider when thinking about these populations. I also want to talk about some overall trends with the ALICE data. These are the big ones that are pulled out in the United Way of Pennsylvania ALICE report. Again, this is the statewide data that we're digging into now. The number of ALICE households in Pennsylvania is increasing. We're also seeing the cost of living increase for ALICE households and more vulnerability for our workers as wages tend to stagnate in ALICE jobs. And keep in mind, this is the 2018 data. So with the COVID crisis, there's definitely some added implications, but we'll go over those a little bit later in the program. So I just wanted to share this graph with you on the left-hand side. The bottom line that you're seeing here is the number of households that were considered below that federal poverty line that we talked about earlier between 2010 and 2018. And you'll notice that this has stagnated. This has pretty much stayed the same. The top line over here is ALICE, and these are folks who are in that ALICE threshold that we mentioned. And you'll see that this is increasing and increasing. So that goes along with those trends that I was just showing you to show that, you know, even if the federal poverty line is staying the same because it's not really the best measure of who's struggling, the ALICE population continues to increase. And when we think about the demographics of these folks, we see that Pennsylvania is becoming increasingly diverse. We have a growing number of households that are living on the edge of this ALICE threshold or falling in and out of it. And we also see some of the biggest population bubbles that we have, the baby boomers and the millennials who are aging out of the workforce or aging into the workforce for the millennials. And we're seeing a huge amount of seniors who are suddenly realizing that their expenses are too much for them to handle on a fixed income or something similar. So those are big issues that we're seeing in the trends and demographics, and something to consider when we go back into that senior stability budget as well. So that's very critical. We're also thinking about income equality and wealth and seeing how that will continue to rise. So this graph shows the consumer price index compared to our ALICE Essentials Index. And so the consumer price index, just for some background, this is what the government and the Federal Reserve typically use to measure inflation. So all of the inflation calculations are based on this consumer price index, which is basically a conglomerate of most commonly purchased goods by the American public and how their prices have changed over time. So you'll see that consumer price index is that yellow line. The ALICE Essentials Index is a similar measurement, but it only includes household essentials. So what this graph is showing is that the cost of household essentials like housing, childcare, and similar services is increasing at a quicker rate than the average consumer good. So the consumer price index is what the government uses to set those federal poverty lines and guidelines for public service and public assistance. So if we're using a measure that is really underestimating the cost of some of those essentials because it's including non-essential goods that bring down the overall price index, it's not really the best measure. So I just wanted to share this index with folks if there's any economists out there like me that find this interesting. Okay, so here's some trends with cost of living. We're seeing changes in housing. The cost of living for ALICE is growing, both in the urban areas and the rural areas. This cost of housing is going up. We also see childcare facing new challenges, and so will parents. And keep in mind, this is without even knowing that COVID existed. So think about how these trends might also be very relevant during this time, because we know we've seen issues with childcare because of COVID and changing in schooling and things of that nature. The same with food insecurity, which is a problem, and it's increasing in young adults and seniors as well, those two populations we talked about. We also see higher education. More students are facing greater challenges to meet their living expenses. Folks are having trouble, and more students are working either full-time or part-time. And we also see a growing gap in health based on demographics and environmental socioeconomic factors, which is definitely something that we've seen throughout the pandemic, that issue of health equity. And so this is another interesting trend that I wanted to share with you all. The wages for low workers are stagnating. So you can see the difference here between the high wage jobs and the medium wage jobs between 2007 and 2018, and the number of jobs there. So you'll see that low wage jobs are actually increasing while high wage jobs are either decreasing or medium wage jobs are staying about the same. So our economy is having more folks who are low wage workers. So I thought this was interesting. If anybody was on the economic forecast breakfast this morning, they showed also when COVID hit that low income workers were much more likely to be affected by the crisis. So I think that those two things kind of go hand in hand. If you remember that graph from the presentation this morning, if anyone was on it, that we're seeing both, these low wage jobs are more prevalent, and also those are the folks who are harder hit by the pandemic. I also wanted to share this quick graph with you all. This shows the breakdown of workers in our economy and who's a full-time salary job, who has a full-time hourly wage, et cetera. And this is important because ALICE sees more fluctuation in their job hours and schedules than a salary worker would. So that makes it more difficult to budget. They may not have benefits. They may have gaps in income that they're not expecting, things like that. So that's something to think about. Okay. And so here's another trend for you all. We're talking about the landscape of work on this slide. From the 2018 data, we were seeing that economic growth was led in non-traditional work, small business, and the gig economy. So when we're thinking about the gig economy, those are things like Uber and DoorDash and things like that, where people can hop on and do something, or things of that nature. And I think we've seen an uptick, especially in food delivery service for during COVID. I know my house has seen an uptick in that, at least. The rise of automation will require a workforce with more digital skills. I know this year we've definitely experienced that need for digital skills. Number of low-wage jobs will continue to increase despite automation. And then again, students being a significant portion of that labor force. And I know I've kind of been tying in ALICE and COVID-19, but I have a slide for it too. We'll be more explicit about it. So obviously this ALICE data is 2018 data, so it was taken before COVID-19 really hit our economy. But I think it is a really important baseline measurement, because as we go forward in the post-pandemic world, we're going to really be happy to have that comparison data to look back and say, okay, how bad has this crisis affected our economy and our businesses and folks in the ALICE population who are struggling. So definitely something that's an important benchmark for us, a baseline. Furthermore, this is really important to direct programming and resources and services during the pandemic to think about, who was vulnerable before, and might that population also be vulnerable and more vulnerable now. So really this pandemic has exposed a lot of the issues of economic fragility and this widespread hardship that we're seeing in these ALICE communities. It's really brought it to light. So we have another poll for you all. I am going to share after this poll some data that United Way Worldwide put up as a supplement to the ALICE data. That's a specific COVID impact survey for Pennsylvania. But first I want to kind of quiz you all and see what you thought came of this information. So I'm going to ask Flame to go ahead and pull up that first poll for us, and we're going to take a couple minutes and answer some questions and see what everybody thinks.
Just confirming housing, yes?
Yeah, it doesn't really matter the order. You can start with housing. Okay, so what percentage of the respondents to United Way of Pennsylvania's survey said that they were concerned about housing expenses more than contracting COVID? And we'll give that about 45 seconds. Okay, it looks like the voting is leveling out. So let's see how we did. I'll share this results with everybody. We're about 50-50 split about whether we think it's 68 or 44%. And I'll share all the results at the next slide, but we'll go ahead and do the second poll as well, Flame. Okay, what percent of respondents to the survey reported being unable to afford food? Okay, a couple more seconds here. It looks like we got 31 responses out of 37. Okay. Share those results. Okay, most of us, 53%, think it's 58, but a bigger split this time, not so even. Okay. We'll go ahead and do the next one. Ooh. Sorry, Flame, I'll let you control it. Okay, and so this is what percent of survey respondents reported changes of employment, like job loss or loss of hours during the pandemic. All right, so the winner on that one is 61% with a couple of folks all over the board. Okay, well, thank you for participating in that. I'll let you know if you're right. Just a second. Okay, exit out of that. Okay. So 44% was the answer to the first one for our housing study. 44% of households below the ALICE threshold are more concerned about paying housing expenses contracting COVID. And there's a couple of other stats on the slide that I didn't share with everybody. 77% of folks, 77% of folks had less than a month of savings. 64% report reducing their hours or leaving a job to take care of a child during the pandemic. We have 32% of folks who are saying that they're concerned about internet because of distant learning. And then here's another one of our answers to the question. 58% of folks had reported that they were unable to afford food, and another 43% said that they used a food bank during the crisis of this ALICE population. And finally, 70% of the ALICE population, which I think is a really staggering number, reported changes in employment, loss of job or loss of hours, and 52% of that population applied for unemployment compensation. So we can really see with this data point how much the COVID crisis has impacted this population. So just to share that data with you, I think that United Way Worldwide will be continuing this survey of COVID-19 and collecting more data on this topic, and continue to put out information regarding this intersection of COVID and ALICE. Okay. So I'm going to share now some of that place-specific data that I was so excited to talk to you all about. This is ALICE in Lebanon County. And like I said, one of the big benefits of having this data set is that the costs are specific to our community. So in Lebanon County, this graph on the left you saw earlier, but this is specific to our community. It's comparing poverty to ALICE. And as you can see, just like the statewide trend, our community is increasing the number of folks who are ALICE here, while the federal poverty line pretty much stagnates. And then this is just the number of households, the median income, the 2018 unemployment rate. That's not accurate right now. ALICE households was 27%, and I'm sure that's increased as well. This is a very interesting graph. I pulled out some county subdivisions from the ALICE of Lebanon County report. This is not a comprehensive list. There are other townships and boroughs in Lebanon County that are included. And if you're interested in one that you don't see on here, you can find that information on our website. But I just wanted to pull some of the big ones out here with high populations. And on the map on the right, you'll see the darker the value, the higher the population of Alice in that community. And we see the total number of households listed as well. So Anvil Township, 46% of folks in that community are below the Alice threshold. In Lebanon City, it's 60%. In both Myerstown and Palmyra, it's 48%. So really think about that. Almost half of the people who are living in Myerstown, Palmyra, more than half in Lebanon City, and about half in Anvil are struggling with these issues. And after the pandemic, I can only imagine that it will get worse. So I think that's some interesting data that I'd like to share. I wanted to delve back in a little bit to the cost of living for seniors. We're about to dive into those budgets that I discussed, those place-specific budgets. So I just wanted to share this slide again and explain why there's a separate budget for the senior survival budget. This reflects the reduced spending of food. Seniors tend to eat less than younger adults. You also have reduced spending on transportation because they don't travel as much for work and for family responsibilities. I know we all really don't travel so much for work anymore if we're working from home, but this, like I said, is before COVID data. And so this is an interesting data point. And also they have increased healthcare needs on average. So, and those healthcare expenses tend to outpace any benefits received through Medicare. So here is our household survival budget. I'll give everybody a chance to just quickly take a look at what these categories are. I mentioned them earlier. We have housing, childcare, food, transportation, healthcare, technology, miscellaneous taxes. And so those are all added up for an annual total of what someone would have to make for the bare minimum to survive in our community in Lebanon County. So for a single adult, that's $24,000, $35,000 for two adults, a family of four, about $57,000, and it goes up from there. And the really interesting thing about this data is that if you go onto United Way of Pennsylvania's website, you can actually customize this to a specific household size. So if you happen to be a household with a single parent and 3 kids, or 2 parents and a grandparent and a child, or whatever it may be, you can actually go onto the United Way website, which we'll share in a follow-up email, and build your family unit and see what the bare minimum budget is for that particular family, which I think is nice, that because it's so customizable, you can really use this tool. So that's interesting. And then on the far right, we have the senior budget, which, like I said, has those different costs depending on the food costs and the different costs for healthcare in particular is a big one. And we have 2 seniors as well. So it's very nice because you can kind of play around with these budgets. The one category that you did not see included in that budget is savings. Folks in that category have absolutely no money to dedicate to savings or emergency funds or anything like that, which is why that makes them so precarious, because any crisis can really completely uproot an Alice family and kind of swing them into a tailspin. So it's really difficult. So for the next thing I'll show you, which is our household stability budget, savings is a category. So you see there is this little area here for the amount of money that they can put aside each month into savings. But keep in mind that most of the time when you're still in that tight budget situation, those savings aren't accumulating for long. Because if you have an emergency like a car repair or something like that, it's very easy to begin dipping into those things and spending those savings. So just because Alice in this budget has a small amount of savings, it doesn't mean that that's accumulating enough to put a down payment on a house or anything of that nature. They're just a little bit more comfortable than the folks who are living on that bare bones survival budget. And I really wanted to share this slide with everybody because this sums up what the impacts are if we solve these problems. So, and it breaks it down into both the impacts for our community, but also the impacts for the particular families and that Alice population. And they're all kind of interrelated. So when you see folks who are having the opportunity to have safe, affordable housing and quality childcare and education and adequate food and all of those things that are so important to life, You have also safer environments and improved educational performance, less food insecurity, less need for healthcare costs and things like that. But on a community level, you also see, decreased inequities in socioeconomics performance gaps, and things of that nature. You see lower healthcare costs, less traffic, better maintained housing stock, less crime, improved productivity in the workplace. So it really is that concept that the rising tide rises all ships. And so the community at large is also improved when these ALICE folks can get all of the things that they need to have a sustainable household. And here's just some more indicators, those quality healthcare things, reliable technology and savings, and how those impact both ALICE individually and our communities. I also wanted to share today a couple of programs that United Way supports or funds that are related to this ALICE population. We have 211. I'm sure many of you have already heard about 211. It's a non-emergency social service hotline, which connects folks to any type of social service that they may need, from housing to food resources to mental health, whatever that may be. So a lot of folks who are struggling in that ALICE population might see this as a big resource to be able to call one number and be connected to a variety of different services, which might be useful for them. I also mentioned My Free Taxes, which is United Way Worldwide's tax tool, free tax tool for folks who are looking to file their taxes independently. You can go on My Free Taxes and file on that website for free. So that's a tool for folks in the ALICE population, and really, anybody who qualifies to do so without spending extra money. I also included a photo of volunteers in medicine down at the bottom left. I mentioned earlier that a big issue is having a part-time job that doesn't have benefits, or even a full-time job that's hourly wages where you don't have healthcare. And this is a lot of folks in the ALICE population. So any community resource like the Volunteers in Medicine Clinic that can help subsidize those healthcare costs for underinsured or uninsured folks is a big help for the ALICE community. On the same vein with that healthcare cost, we have FamilyWise, which is a discount prescription card service that we distribute as a United Way. And so this is a program that folks can use at the pharmacy to get discounts on their prescriptions, which can be a real help for families who are really on a tight budget, but have to, pay for their medical costs. I also included the Lebanon County Christian Ministries, and I really wanted to be sure to include them in this slide because many of the folks who are staying at their shelter are employed. And so I think a lot of people don't realize how many of those individuals are working, some of them working full time, and still just trying to make that minimum survival budget. So that Lebanon County Christian Ministry is their shelter is funded in part by United Way as well. So those are just a couple of programs, and we're going to get into some case studies soon. But moving on to the uses and applications of the ALICE data. Like I said, this is really beneficial for tracking progress over time, having that same data set and being able to refer back and saying what the baseline data is and how we've improved on those measurements. Building targeted programs around these issues. And one example is workforce development, and we have a good case study later about how that work can be done. And finally, mapping resource gaps in our communities and figuring out, how we as a community can supplement those resource gaps. Maybe a community that doesn't have good preschool or childcare that's available to the public, whatever it may be, transportation issues. How can we use this ALICE data to look into those gaps and start filling them in? So this is one case study, one example that I wanted to share with you all, the Economic Recovery Plan, which is just in its planning phases right now for Lebanon County. And this was put together by a group of community leaders along with some economic consultants who are working to build a community-wide COVID-19 recovery plan for our economy. And so our CEO, Brooke Smith, sits on this as a member of this task force, and they have been digging into this ALICE data and using that to really present what the disparities are in our communities so that we can help build a targeted plan to address those issues. So this work is all informed by the ALICE data and takes into consideration those families who might be missed by those other measurements of poverty, like the federal poverty line. So when we're analyzing this data, we can be a lot more inclusive in the way that we're building out that work. So this is just one example of how this ALICE data is currently being used in our community to build some awareness and direct some resources to folks who are really struggling. And so that brings us to our first case study of the evening. I have my friend and colleague Fitzroy Lewis here, who is employed with SARC, and he is working on the Connected Together Community Violence Prevention Initiative. So I am going to pass the program over to Fitzroy for a bit, and he's going to share a little bit about his work and how that relates to ALICE. So thank you, Fitzroy.
Yeah, thank you very much, Dee Dee, and thank you everyone for the concern that you have for the well-being of our communities and showing up to hear a little bit about some of the challenges that our communities face. So I'd like to just stop for a minute and ask you to consider, how would you define violence? I'll just give you a few seconds to ponder that. And especially in light of what we just heard, how would you define violence? So one of the things that I did was to look it up, because oftentimes, we think we understand something, and when you go to pay closer attention to it, you realize that, yeah, I kind of had a sense, but maybe not as deeply as I could otherwise. So here are a couple of definitions that I think are apropos for our conversation this evening. One is strength of emotion, and another is an unpleasant or destructive force. So as we were watching the video, which Dee Dee used to introduce the conversation this evening, one of the questions that really struck me was, quote, "Can you imagine the stress of living on the cusp of such financial insecurity?" That stress, I would contend, is a form of violence. When we received the grant from the Pennsylvania Coalition, the Pennsylvania Commission on Crime and Delinquency, that grant was meant to address the impact of trauma and how trauma leads to violence in our communities. And so the Community Violence Prevention Program is something that is being worked on in conjunction with the Community Health Council by SARC and the United Way and DVI and Empower the Mind. So if you go to the next slide, you will see that ALICE data was used to determine which communities we were going to focus our work on. So while we work in Lebanon County, we are providing free mobile trauma therapy to all and any Lebanon County resident. That is one thing that we're doing. We're also increasing the individuals who are able to use EMDR as a modality for delivering service for individuals who are experience or have experienced trauma in their lives. And by doing that, we are hoping to increase the capacity of individuals to receive more service. You saw these numbers on the previous slide where the communities were highlighted. So as Dee Dee said, when you look at Anvil Township, you look at Palmyra and Myerstown, that means 1 in 2 individuals who reside in those communities are below the ALICE threshold. That means these are individuals who are likely experiencing a great deal of stress in having to contend with that economic instability. And of course, in the city of Lebanon, the numbers are higher. It's 3 in 5 individuals. So in these, because these 4 localities have the highest numbers of individuals below the ALICE threshold, it made sense that we would pilot the program that we are using to develop community engagement and to serve as a framework for coalescing community partners to learn about what are the risks associated with their community, and but also the assets. Didi mentioned about mapping where resource gaps would exist, and that's an important aspect of any work, knowing what you're missing. But it's also important for us to know what we have. And so identifying what are the assets in each community, Lebanon County as a whole, but also in each one of these local communities, identifying what those are. And when we identify what the risks that exist in these communities are, then determine how can we use the assets that we have to mitigate the impact and the risk that exists within those communities. And so we are introducing the Communities That Care model, which was developed at the University of Washington and has been used in the state of Pennsylvania since 1994. It has been supported by Penn State, which oversee training in the program in the state of Pennsylvania, and also both at the Pennsylvania Commission on Crime and Delinquency and DDAC. So that's the department that deals with drug and alcohol as well. So because they recognize that this is a proven method of dealing with community issues, and so this framework allows community members to organize themselves as a community board, develop a profile of their community, and then create a plan that would address whatever risk they have identified to be a priority in their individual community. So, this is not this is not an outside agency coming in and saying, well, we've looked at your community, we believe this is an issue, and we think this is what you need to do in order to resolve that issue. What we are saying is, you live in your community, you have a vested interest in its well-being. You care about its future because you live there, your family, your friends live there. And so because you have this passion for improving your community, we would like to solicit your help in identifying what are the issues that you would like to see resolved in your community, combine with other concerned citizens, other agencies, and develop a board that is able to do a study, and we would help with doing the data research and providing the data to be able to assess what are the issues that the community identifies, help the community to prioritize what those issues are that they want to work on. And then once those priorities have been set, then also use evidence-based methods that have been proven effective over time to address whatever that particular issue is that each community would determine that they would like to resolve. And so once we implement the program or strategy that would be working towards resolving the issue, we would of course evaluate it and then make whatever tweaks were necessary in order to make it more effective. Because as we know, we live and learn, right? So when we undertake a particular endeavor, we're going to be able to learn from it and be able to make adjustments. And the hope is that the community itself would embrace long-term the functioning of the board, because this is a community problem. And the idea that any one agency, any one entity is responsible for solving it is not fair to that agency. We had a recent issue in Anvil where, because subsequent, really following right on the heels of each other, we all have heard of the sad case of Max Stollenberger, and then the recent issue with the Duncan family. And the Anvil community was really stunned by these occurrences. And I guess understandably, the reaction was, well, who could have done something? Well, my challenge to each one here this evening is that rather than looking for someone else to do something, why don't we do something? Why don't we combine our assets? Because each one of us is an asset. Are you? Yes, you are. Whether it's your knowledge, whether it's your experience, whether it's the leadership position that you have, you can be effective in helping to resolve the long-term consequences that come from the economic instability that exists and creates pressure and stress on families, which then in turn, not causally, it doesn't cause violence, but it will, in many instances, be found to be a strong correlation between low socioeconomic status and high incidence of violence. So each one of us, as an individual, but also as individuals who are engaged in community organizations, can be an asset. We can be a resource to combine our knowledge and our experience to be effective much more than we have been in the past in addressing these issues and improving the well-being of our communities. So in each one of those 4 communities, we are forming a community board. We are looking for individuals who would like to volunteer, even if it's just your experience. Maybe you have the time. If you don't have the time, you may have knowledge. That we are asking you to demonstrate your outgoing concern for the well-being of your community by volunteering whatever time you care to give to be able to be a resource in accomplishing the great work that's ahead of us. Because if we are going to improve the well-being of our communities, it has to be us. It has to be us. There is no one coming from the outside to save us. And so we must be willing, and I think, what we have here this evening are a number of individuals. I've spoken with many of you before. I know that this is a group of individuals who care deeply. But can we bring others in? Can we encourage others to participate? Because it's going to take more than us this evening. It's going to take a whole heap of us as a community to be able to combine our knowledge and combine our experiences, combine our assets, whatever that may be, and be able to connect the dots so that we are recognizing a more efficient, effective way of addressing these long-term problems that cause destruction in our communities. So I'm appealing to you to dig in a little bit deeper and find out where you fit in as an asset in creating a connection with other community members or with other agencies that would allow you to have a part in improving life in Lebanon County. And so you can reach out to me. I know that many of you already have my email address. If you don't, I can put it in the chat. I'm at SOC. I should be difficult to find, and Diddy certainly knows how to find me, as anyone from the United Way as well. So I would love to hear from you, even if it's just to give some suggestions and some ideas. I would greatly appreciate that because it's up to us. So with that, I'm going to pass it back to Didi.
Thank you, Fitzroy. And we can certainly share your contact information in our follow-up email as well. If anyone's interested in getting in touch with Fitzroy, I'm sure he would love to talk to you. It's one of his favorite things. So we also have Cheryl Heister today, and she is from the Literacy Council of Lancaster and Lebanon, and she has a case study for us as well. So I am going to just pass the mic straight on to Cheryl.
Okay, and I'll move through this quickly because I think we're running really close to the end of our time here. So the situation that Alice families experience is really complex. And I think we saw that like in Dee Dee's presentation and in the description of the project that Fitzroy is working on. And those kind of complex problems really do require complex solutions. And they don't exist in isolation. And I think that the work of United Way in beginning to, to really support collective impact partnerships is a great way for us as a community to be thinking about how we can work collaboratively to address some of these really big problems. And I think genuine impact partnerships happen when people come together with a common agenda and they work collaboratively to support the activities of each other so that we're kind of all working in the same direction. And we rely really heavily on really, important continuous communication efforts. We're looking at data and we're using data for decision making, and we're, figuring out how we can share that information with each other. So the project that I'm talking about tonight is called Pipelines and Pathways to Success. And one of my partners is here tonight, Lee Smedley from Support Connections of Lebanon County. So I want to give Lee a big shout out and a hello. And Lee, please feel free to jump in anytime. But this is one of several collective impact partnerships that is funded by United Way of Lebanon County. And our purpose is to increase the number of adults who are self-sufficient in Lebanon County. And as you heard, there are many barriers to self-sufficiency, and we as a partnership strive to support people on their journey in overcoming those barriers. So Dee Dee, if you could go to the next slide. Barriers to self-sufficiency are also really complicated and rarely occur in isolation. So the programs and the activities of Pipelines and Pathways are really designed to address, the skills and the support that are holding people back. So some of these activities include adult literacy and basic education, where people who can prepare for the high school equivalency diploma if they don't have a high school diploma. Many of our learners have high school diplomas, but really don't have the basic academic skills. We're also looking at workplace readiness, career exploration, career awareness. We work on career development planning and plans that the participants work on with career navigators and teachers. We also help them look at how they can assess the barriers to their success so they can start to make plans to address those as well. Through our partnership with Probe, they are working on financial education piece and supported job search. Our partner with Support Connections of Lebanon County is really focused on the care management and mentoring. And with IU13, we work on integrated education and training initiatives. So one of the things that I thought would be really important to talk about was that a lack of basic skills is a really big barrier to self-sufficiency in our community. And I think that most people are pretty surprised that 20,000 adults living in Lebanon County struggle with the most basic literacy skills. And what that means is that they're not able to read independently. They couldn't read a book or the newspaper independently. They would struggle with even very simple prose. So I would encourage you to check out the Program for International Assessment of Adult Competencies, so you could see for yourself how Lebanon County fares with neighboring counties, with counties across Pennsylvania, with and even across the nation and internationally. And because you'll be getting the slides, you'll be able to link up and follow these links on your own if you're curious. It is always a surprise to me. Like we haven't had data about our county estimates since 1990 when we had the National Adult Literacy Survey. So I think it's really important for people to understand that this is a real issue in our community. So I know what I thought when I first got involved in adult literacy and basic education is that how could this be possible? We live in a nation with compulsory education. How is it that people can grow into adulthood and not be able to read or apply math and numeracy skills in their lives? And there are pretty much three primary reasons that happens in our country. We have a pretty big high school dropout rate. While that percent may not look big, it's a lot of numbers, right? It's a lot of people that separate from school early. And the way schools report separating from school early can often be pretty misleading. So the reality is often worse than what we look at in terms of data. And then we also have people that graduate from school, that have, IEP diplomas. They have either diagnosed or undiagnosed learning disabilities and differences that made, developing those skills really difficult throughout their educational experience. And then finally, this also includes people who are speakers of languages. So while they may be highly literate in their native language, they are struggling with English in terms of reading. So, I wanted to also, could you move to the next slide? I'm sorry. Let's go back one more. I'm sorry. I got ahead of myself here. So the other thing that I just wanted to point out, and I didn't include this in the slide, that's why I got confused, was that there's a really good article, and maybe we can add that, Dee Dee, when we send out the slide, that's written by Groger and Jackson. It was published by the Brookings Institute back in September, and I'll make sure that Dee Dee gets the link so you can look into it. But we're talking about a skills gap in pipelines and pathways, and that's really what we're doing programmatically, is addressing a skills gap. But I think it's really important to note that a strong impact scenario in terms of job growth, those days of having, more jobs than people are kind of a distant memory now, aren't they? And I was really struck by the idea of that the number of jobs for people who don't have a high school diploma is going to decrease as a result of COVID. So if you don't have any college or no high school diploma, you're looking at a zero or negative job growth opportunity in a COVID economy. So we have a lot of work to do, not only to help our participants build skills to prepare for jobs, but we also really need to help our community partners and employers understand that a community is only as strong as its most vulnerable population. So the Brookings Institute article that I mentioned too, that I definitely would like everybody to take a peek at, talks about the reality of opportunity gaps. So it isn't just that people build skills. It's not a transactional kind of a thing, right? There's still a lot of things that impact who has access to good jobs. So if you want to go to the next slide. So most of the people that we serve in pipelines and pathways are Alice. 65% or between 60 and 65% of the folks that we're serving are already employed. They have jobs, but they need a better job because they can't survive on the job that they have. So again, while we believe that building those skills is really important, I just want to emphasize that it is also an opportunity gap that is a big barrier to people being self-sufficient. And we can go to the next slide. And then lastly, one of the immediate and big impacts of the pandemic on our most vulnerable residents was digital exclusion. So the students in my program on March 14th, right, were coming to face-to-face classes, and we were primarily a face-to-face program. On March 16th, we had 41% of the students who were coming to class the week before able to continue because we went to a completely remote option, right? So when we did that, we lost more than half of our students right out of the gate, and had to come up with really creative solutions to keep them connected by like driving to their house and giving them textbooks and teachers talking to them on the telephone. So we realized that we had to make digital inclusion a priority within our program, and then even like thinking about it more broadly in the community. So there are it's a three-legged stool for digital inclusion. It is one, having equipment, and having equipment that works and is good enough to use. And then 2, it's having internet and having good internet that's reliable. And then 3, it's having digital literacy skills to use that equipment. So that's what we're really focusing on right now, is making sure that we've added a whole digital literacy component to our program. We are giving students computers. We have partnered with an employer who has donated more than 150 laptop computers that we are giving to people so that they have a computer. And if they're struggling with even getting connected to the internet, we're also helping them figure out ways to do that. So with that, I'll turn it back to Dee.
Thank you, Cheryl. That's some great information. And it really ties in with the ALICE data, especially with the technology and COVID. I think this intersection right here is going to be so important in the next couple of years, how we're seeing how this population, and really every population, is having to interact much more with technology. And I have a couple of facts here. Cheryl pretty aptly summed up the importance of technology for work and education, and applying for different services. Unemployment, I know, was a really big barrier for folks who were trying to apply for unemployment after they lost a job due to the pandemic, and were really having a difficult time with that because they had to do it only on a smartphone, or they didn't have a computer to apply to a job. And so this fact on the right here says 32% of smartphone users with an income below 30,000 have applied for a job, compared to only 7% of smartphone users under 75,000 and applied for a job on their smartphone, that is. So that's a huge number of people who are not really having the best tools to do that thing. Beyond that, households without internet access are at much greater risk of being undercounted in the census, which we know informs government programs and services and representatives and things that are very important for folks. And so I just wanted to briefly pull this up. This is the unitedforalice.org website, which has a wealth of information, a lot of really great data for folks. And we will be sharing this in our follow-up email as well, along with that article for sure. Cheryl will put that in as well. But so this is just a really cool, deeper dig into Pennsylvania's ALICE data. And there's a lot of different things that you can look at: the methodology, the ALICE index, those household budgets. But what I wanted to draw your attention to is this indicators bucket here. And so you can choose an indicator. In this case, we're choosing internet access, and see how that has affected folks below the ALICE threshold in the various counties. In Lebanon County, see what the internet access is. So you can go through and cross-reference the access to a certain thing, compare it to the ALICE population. And so there's a bunch of indicators and really some great data. So I would encourage anybody who's interested in really digging into this work and who likes scatter plots to come onto this website and really dig deep into this, because like I said, this is a really rigorous data-driven study that can really help to inform some of our work as practitioners in the community. Okay. So I just wanted to kind of give some other examples to help people to contextualize this work and imagine what its practical uses are. And so we have already our 2 examples in Lebanon County of folks who have been using this data or serving this population, and that's with Fitzroy and Cheryl. But I also wanted to open our horizons to other possible uses that we could be implementing, or any idea that you might have that's pertaining to this population, how you could use this data. So the first one I'll bring up is the Employer Resource Network, and this is a program that's implemented by United Way of Pocono Mountain. And this is basically an extension of an HR team for several businesses in their community. So they found that many HR staff who are working at local businesses in Pocono Mountain were seeing a lot of people coming to their office for things that weren't work related. Maybe an issue with transportation that was causing an attendance issue at work, or they couldn't get childcare at home, and so many different services that relate to social services and economic well-being that were outside of really the scope of work, but perhaps affecting performance. So it was really a a job retention tool to get an outside coordinator to come in and help these businesses to not only share the cost of helping employees to navigate these resources, but really to just make sure that their employees are supported. So I think it's really been a great resource for folks in the community to be able to, refer folks to an outside network who can help them navigate the resources in their own communities and perhaps solve some of those really tricky barriers to getting to work or getting childcare, which helps both the employer and the employee to retain their employment and have a more engaged and happy workforce. So that's kind of a win-win, thinking about how this could be applied in the business community. And another example that I'd like to share is from United Way of Chester County. They have the Mobile Home Tax Assessment Project, which is another really interesting project that centers around this community. And basically what was happening is mobile homes were being assessed for taxes as if they were appreciating in value like a regular home. And so most people, when they buy a home, they expect to be able to sell that home for more someday. And so it's an investment. But when you buy a mobile home, it depreciates like a car. So these individuals are being taxed for an asset that's actually depreciating at a rate that it would be increasing in value. But since it's a mobile car, it depreciates like a car. So basically what United Way of Chester County organized was a task force of legal teams and social workers and individuals who could go out and inform these people who were living in mobile homes that they may be paying significantly more in taxes than they should be, and helping them to remedy that situation through policy changes or helping them get some legal assistance and working on their cases. So that kind of work is really great. And I don't know the exact number off the top of my head, but I know hundreds, possibly even close to 1,000 houses have been reassessed since this project began in Chester County. And that's a cool project that we can certainly share as well if folks are interested in learning more. So this is just to kind of help people who are thinking about how to use this data and how to solve these problems in these populations that are so prevalent to think outside the box and envision projects that could be implemented here in Lebanon County as well. And so for this slide, I am going to pass things over to Brooke Smith, my boss. The ALICE Solutions Council was something that was formed in 2019 after our first ALICE workshop that we held with nonprofit leaders. And then it met in March of 2020. So I'm going to let Brooke take this slide and share those takeaways from that meeting.
Thanks so much, Dee Dee. And I just want to say publicly, you've done a great job. All the presenters did a great job with sharing information, Dee Dee, and organizing kind of the whole presentation. So thanks for that. Yeah, we had our first ALICE presentation, I believe it was in November of last year. And following that, we really wanted to provide an opportunity for people who felt passionate about this to kind of come together, talk about these issues, but also identify some action steps that we could take. So not just raising awareness, but what are some things we could do, kind of responding to Fitzroy's call of action as community members. How can we come together and really create some change and serve these individuals and help them improve their situation? So you can see some of the takeaways from that meeting, and you can also see the date was 3/10/2020. So we had one initial meeting with that group of really great people who were ready to dig in, and certainly COVID derailed some of those plans, and everybody certainly had to readjust their priorities. And so our goal is to reinvigorate this ALICE Solutions Council. As Dee Dee shared, I am involved in the economic recovery plan team for the county. And so once that plan gets a little firmer, our goal is to kind of reinvigorate this ALICE Solutions Council to hopefully support some of that work. So I appreciate the opportunity to share about that. Thanks, Dee Dee.
Yep, thanks, Brooke. Okay, so before we wrap up our program and kind of move to our Q&A, we should have about 15 minutes to answer questions, and we'll have Flame come on and be a moderator. But we wanted to leave you with some thoughts about the next steps for envisioning this work in our community and actually getting to the work of implementing some solutions. So some of the things that are that we can do now that are already happening is connect folks to these existing initiatives that we're talking about, to, 211, Family Wise, those projects that we heard from earlier with Fitzroy and Cheryl, Community Violence Prevention Initiative, and Pipelines and Pathways to Success. There's some great work that's happening in this community right now in this space. So one way we can help is by referring and spreading the word about some of these initiatives and programs. Also, in general, just raising community awareness, sharing some of this data that we send to you afterwards with your network, with folks who are interested in this work. And, to borrow Fitzroy's quote, be a part of it yourself, and really work to engage your network in it too, because we really need as many folks as we can get working on this with us. Utilizing this ALICE data to inform and direct services. And this is a particular bullet that is for the nonprofit community, but certainly it could be applicable to you if you're a business person as well. How can I be thinking about this population as I'm thinking about, my practice and my work in the community? Like I said, sharing this information with others, advocating at whatever level you can for policy changes. If you have somebody's ear in politics, this is something that needs to be talked about. I know United Way of Pennsylvania, a huge piece of their work is advocacy. So I know they're always working at Capitol Hill to try to push through legislation that can make a difference for ALICE and the folks who live and work in our communities who are struggling. So that's something that we're thinking about as a network, and we'd love to have anybody's help in that work as well. So we're going to be talking more about the economic recovery and doing a deeper dive on that economic recovery, and hopefully setting up some more community conversations like this in the future. So keep an eye out for more communications about ALICE and more opportunities to engage, perhaps in a more open conversation kind of format the next time we talk about this topic. And we wanted to first give an introduction, but if you're interested in this work, we'd love for you to stay on and keep talking about it with us and continue this journey of working through this with ALICE and our community. So we are going to move to the Q&A. Flame, I don't know, I haven't checked the chat box. Do we have questions in there?
We do have a few. I'm going to kind of start with just a quick question to Mike and make sure that the site with the indicators and the demographics and things sort of specifically addresses his question about being able to break down the data to look more specifically at things. I'm pretty sure that site might answer that question for him, but sort of not quite related. He says, I'm wondering what opportunities exist within United Way to intersect the ALICE data, which kind of is a lot more focused on money. It's a lot more financial based in its application, to look at other notions of well-being. I think my direct correlation would be sort of the work that Fitzroy is doing, kind of connecting that to that violence, that the effects of what happens when people are in these positions of finance and how that trickles down.
Yeah.
So
I want to comment I also recommend that he dig into the methodology that we'll share with him, which is a really great way to see what exactly is going into that data and some definitions. And for folks who like research, that's a really good document to dig into to really understand the report. And we'll be sharing that. But Brooke, do you have any other comments?
Yeah, I think on the website that we shared with some of the indicators, you can also kind of cross-reference. I would say some indicators of well-being. It shows percentage of low birth rates and birth weights. Sorry, not birth rates, birth weights. It also talks about number of kids who are insured, and so I think it is trying to cross-reference some of those things. But to Mike's point, certainly the economic challenges that ALICE faces aren't the whole story, and I think hearing from Cheryl and Fitzroy, they certainly pointed that out. There's barriers to accessing things, and they're way it's way more complex than just a financial hardship that these folks are facing. So certainly,
I'm sorry if I could just add. I think that I'm so glad that question was asked, because I think that it's one of the things that plagues me so much about the work that I do, because there is, like, for so long, I think we wanted to believe that, like, if you just did these things, it is transactional, right? And the reality is that we don't exist in a neutral level market that affords everybody equal opportunities. So I think we need to remember that getting good jobs takes more than building skills. We need to understand that, who has access to the best jobs is, a really important component of that. So, and that is also like the multiplier effect of all of the other things that Fiskar brought up. So important awareness.
So then another question came from Lee on the info on the single parent households in Lebanon County. Similar response to that, Lee, you can find that directly in the demographics. It does break down, Alice, by that population. And I think if I recall, and I haven't looked at it, but I think it goes down to like male versus female single head of household. So there is a lot of data out there that you could really dig down into to find those types of things. Here's one other question that comes from Holly, though, that you guys will love. This is one of those big questions for discussion, is addressing the national and state dialogue around raising the minimum wage and the impact on employers.
So this could be a whole community conversation, Holly, but I think it's certainly it's something we can't avoid. We have 10 minutes left in this session, and I think there's some folks probably on this call, I know not to call anyone out, but Susan and Karen kind of working on the Chamber and the Economic Development Corporation side. Cheryl, I know, has some really passionate thoughts on this. I guess to address it from the United Way perspective, I think that, it's not as simple as let's just raise the minimum wage. However, I think, everybody has a responsibility in helping to come together to lift these folks out of Alice. So I think there's a complexity to it, but certainly, is there a responsibility on the business side? I think there is. I think that's the beauty of this economic recovery plan and this group that's coming together, because it does represent all sectors. Business is there, nonprofit is there. Education is there, and so we're really trying to look at each other to say, how do we each give a little bit to help in the end? And certainly I'll open it if any of the other panelists want to.
Yeah, so just from United Way of Pennsylvania's advocacy perspective, I sit on their policy committee, and I know that the minimum wage is something that always is coming up. So it's something that at the state level and beyond, the United Way network is advocating for increases in wages and working as hard as they can to lobby for those kinds of changes at the state level. So it's definitely something that we're thinking about as a network for sure.
So if I may, I just wanted to raise the issue. We all want solutions, and as we've stated before, the problems that we're contending with are very complex, and oftentimes we want quick solutions, and I don't think we're going to get them. Someone made a quote. I was doing a disruptive design study, and I love how the lady phrases this. She said that when we stop to consider that today's problems are yesterday's solutions, that is profound to me, because oftentimes we will, at a moment, want to resolve an issue. And when we think we've resolved it, what we have inadvertently done is create a problem that we're going to have to resolve 10 years, 20 years down the road. That's systems thinking. And I really believe that in all of our conversation, as passionate as we may believe a particular avenue to be the answer, it would serve us well to gameplay that possible solution and wonder, okay, if we do this, what will be the fallout from this, so that we are looking at a possible solution systematically. Because if we just implement what we think is a solution, we may find that that solution creates problems that we're going to have to solve 10, 20 years down the road. It has to be systemic, a systemic approach from a systems thinking approach.
So Holly's got a lot of them today. She says, how do we combat the overarching sentiment about the looming national debt is the reason to cut spending instead of looking at investing in things like childcare, education, and healthcare, which would be long-term benefits to our society?
She's asking the good questions.
I know, right? She's solving the world's problems today.
So I think that that is a conversation that is so vast and politicized that of course it's within the context of this work, but it's so hard to put a finger on what exactly is the best solution and how to address talking about those issues and thinking about those issues in our communities. I think that there's a lot of arguments for different ways that we could be allocating our budget and dealing with our federal spending and at the state level. And certainly that there's benefits and trade-offs of every decision that's made at that level and beyond. So I try to think of it from the perspective of what we can do here in our communities to support this work, because when you get bigger and bigger, we can advocate and work to try to push these issues on a federal and state level. But at the end of the day, we come home to this community where we have to make change happen here. So I try to contextualize it locally.
I think I would add as well, I think the pandemic really brought to light some of these issues and not making them issues for the individual person or the family. But with children out of childcare is being closed and schools being remote, I think it's forced the business community to kind of pay more attention perhaps to some of these things as well, because it is affecting the workforce and it's affecting people's ability to remain employed or effectively meet their job duties. And so I think because of where we are in the state of the world, these things are getting more attention from more sectors than maybe just those who were traditionally focused on some of these things. And so I'm hopeful that as we kind of further and deepen those conversations, it's something we can whittle away and dig into.
Yeah, and I just wanted to add too that I think you can't really overemphasize the importance of advocacy and advocating on behalf of the nonprofit sector and the work that's happening, and also on behalf of the clients that we're serving and the folks that are empowering them to be ambassadors and advocates as well. Because I think that, and it isn't just going to the legislature to ask for money, it really is educating them about Alice, about the clients that we're serving, about the community needs. And I think just keeping that dialogue open is a really important role that we have to take on more seriously.
I think we have a couple more minutes left. Flame, do we have any more questions? I had put together a slide with some food for thought, but I don't think you guys needed it. You had plenty of thoughts. But these are some questions to consider as we're moving forward in this work and some of the big areas we've been thinking about: policy, business, nonprofits. And there's an endless list of questions that we could populate into these different subcategories. But I just posed a couple of questions to you all to think about as you're moving forward in your professional practice, and just be more aware of this population and think about how your work and your policies, whether it's your nonprofit work or the business that you run, or if you're somebody who's a legislator or somebody who has some kind of pull in local politics, how can we be thinking more intentionally about this population?
Edie, I think I see one last kind of big question, and we don't have a whole lot of time, but I don't want to completely pass it over.
Yeah.
Karen asks a really good question about how do you ask employers to provide reasonable wages without closing small businesses who can't absorb the increase in wages? And so, kind of my answer is it's not as simple as just increasing wages. There's so much complexity to it. Those are the types of things certainly we need to consider, especially during a time when our small businesses are struggling too. And so certainly I'll see if there's anybody else that wants to weigh in on that one before we kind of close this out.
Yeah, I mean, I think some of these questions are great and some of them may be beyond my expertise. So it would be great if we could put together, a larger panel of folks who might have some more thoughts on these things and some more insightful comments than I might have on this particular issue. But yeah, it's definitely something that we need to be considering and thinking about in our communities as we're looking at that trade-off between supporting our own community and supporting our small businesses and the workers that make those businesses run. So definitely something to consider.
So I just wanted to say quickly, the conversation that Karen Gross started, I mean, she asked a great question, and then Susan Eberle's response, and then Candy just put a portion of her thoughts into that. I mean, this shows how significantly important conversation is. If we don't go in thinking that our way is the only way, but we are willing to add on to each other's thoughts, we're willing to parse it and maybe have different combinations. That was a beautiful exchange. I really appreciate that, and we need a lot more of that, because it's not just one entity, not just one person, not one individual with power, whether it's the governor or even the president. It's us. We have to put our heads together and make our community better, but we have to do it by listening to each other, not just taking this position that, I think I know it, and so it's only my way. That was beautiful exchange, Karen and Susan, and then Candy. Thank you.
Yeah. And just to piggyback off what Fitzroy said, I think it's so important to come into these conversations. Like, as the United Way, we're not here to offer the magic bullet solution to folks. We're here to invite people into the conversation so that we can work together and build solutions that are community oriented, very similar to Fitzroy's model that he was presenting earlier in the presentation. So I think that that's so important, that we're asking tough questions and encouraging dialogue and thinking on every side of what these issues and solutions mean for folks.
Great. I think, we're kind of right on the nose here at 8 o'clock. I just want to share, if anybody has ideas, I think we've kind of just scraped the surface and given you a lot to think about. And it would be great to continue some of these conversations and these big questions that maybe could really require a lot of dialogue and brainstorming. So if you have thoughts on what that could look like or what that should look like, we are happy to continue convening folks around some of these things. Please feel free to reach out. There will be a follow-up email tomorrow, I think, with the slides, some information from the presenters. And I just wanted to say thanks so much again to my team. They worked really hard in putting this together. And for all of you for spending your evening. I know time is precious, and so it really means a lot that you care enough about the community and the people that we're serving to, be here tonight. And so, Dee, I'll let you say any final words.
Yeah, thank you all for being here. I know that there's a lot of wonderful people on this call, and I echo Brooke in saying I just really appreciate you all showing up tonight and taking the time to listen to some statistics and economic data and some of those applications to serve this population that is really struggling here in Pennsylvania and in particular here in Lebanon County. And so I just ask that everybody, as they're moving forward in their work, think about this, share this information with your own little community that you have. And so I think the more that we're talking about this, the less it becomes an invisible problem, and the more it becomes something that we can address and break apart and find solutions to. So I just want to say thank you so much to Fitzroy Lewis and Cheryl Heister for being here with us tonight. You both did excellent jobs presenting, and really appreciate you all joining us tonight and sharing your insights and work with the community. Again, always thank you to Brooke and to our moderator Flame tonight, and everybody for just participating. So again, if you have questions, if you have any comments, or if I didn't send you enough links and you want more, I would be happy to share them with you at any time, because I have an endless amount of Alice links that you can dig into. So thank you all, and I hope you all have a wonderful evening. All right, see you everybody.
All right, thank you everyone. It's up to us.
Gracias.
De nada.
Thank you all.